What's up, everyone? It is Dr. Charlie Johnson, physical therapist. In today's video, I want to share with you a brief conversation I had with a member of my private coaching program. His name is Stan, really cool guy, inside my Glute Relief Accelerator Program, around the topic of Piriformis Syndrome. So it's sort of this diagnostically muddy area, and there's a lot going on there. So he asked a very good question about Piriformis Syndrome that I think many of you might have if you're dealing with a pain in the butt and you think that might be the problem. So I just want to share with you sort of a candid conversation, let you in on my thoughts on the diagnosis, how common it is, and just sort of, again, have an open conversation and, let you in on the discussion that I had with him around this whole concept of, piriformis pain. Does it exist, right? You probably heard the piriformis muscle, right, can compress or entrap or, pinch the sciatic nerve, right? So does it happen? Why? If so, what does it mean? And how can we sort of make sense of this, right? So look, if you've been trying to figure out the cause of your buttock problem, and or you've been, reading about Piriformis syndrome and sort of all the things that can happen down there, and you're just not sure what the heck's going on, and you're looking for and or interested in hearing some expert advice on the topic, because this is all I do, then this video should be pretty darn thought-provoking and give you just another way to look at the problem and sort of shift your paradigm around it. So hopefully this video is helpful. I know it will be. Check it out. We'll hit play here in a moment. That being said, real quick, for those of you who do not know me, my name is Dr. Charlie Johnson. I'm a physical therapist. I have my orthopedic board specialty. And again, this is what I do, meaning I help people all around the world with unresolved back, butt, and sciatica problems, basically learn to fix themselves. So my goal is to teach you how to solve this problem by giving you tools, knowledge, understanding, as well as resources / support, right, to sort of become self-sustainable and your own best healer, such that you don't need to rely on other folks and or pill shots, surgery, things like that. So if that's interesting to you, then go ahead, hit like, hit subscribe for other like videos. Also, the purpose of this video, even though I am going to chat about the topic, and it might give you some insight there, is really not to help you figure out or diagnose if you have Piriformis syndrome or not. If you're interested in doing so, check out my DIY diagnostic guide, should be somewhere up above. And I literally let you inside my brain and show you this whole if this, then that algorithm. You can walk through a diagnostic flowchart and figure out the most likely source of your pain. All right, so let's get into it. Here's the chat I just had the other day with Stan.
Yeah, and can I ask you one more question? It's something that's been kind of on my mind. It's a little off, I guess, a little off of what the conversation was today, but Piriformis syndrome, I want to ask you about that. Like, is that a thing where literally the because I have that in my mind and I just want to get that out of my mind. Like when the piriformis muscle gets bigger or whatever and wraps around that nerve, because that's what it feels like when I squat or lunge or something like that.
Yeah.
But so is that a thing? And do you think that that's related to me? I just want to hear your answer and thoughts on that.
Yeah, dude. So here's what I can say. All right. So I had another woman in the program, ended up doing really, really well, dude. And she came to me in all this pain. Of course, her brain's going what could this be? Whatever. But here's what happens, man. When you're in pain, we're biologically wired to go back to the structural. There's just, I think that's happened. Literally, dude, I had a lady, she literally said to me on the call when we were trying to determine if it's a fit in the program, I can feel my nerve twanging, right, in my whatever. And 7 days of brain retraining, if you want to call it that, 20 years of pain gone.
Wow.
Right. So it's very real sensation, man. Just like when you're I'm feeling sad, right? I feel like my eyes are watering. They are. Okay. You're not making it up. Your arm does hurt. Your leg, your butt does hurt. Okay. Right. But it's why it manifests there for you versus somewhere else, hard to say. But yeah, so here's what I'd say. Going back to the lady I was recently talking about, not the one who felt her twanging, but this idea of this person, I was saying, hey, look, I really think this is this, and here's what I think we need to do. I don't think it's purely structural, etc. And she's like, well, I had this MRI. Curiosity got the best of her. So she's got this MRI, right? And she said, my piriformis was actually atrophied or smaller on that side. And I said, well, that's great news because, right, if it's bigger, that means there's less space there logically, right? And you would, so here's where I'm getting at. No matter what shows up, people will justify it.
Oh, okay.
So
Gotcha.
If it's smaller, then she's saying the reason that it's a problem is because it's weak and therefore I need to strengthen it. And that must be it, right? But then when it gets fat, right? So then there was another person who had the same exact symptoms as her, who was like, well, that's weird because like, I wish mine was small. Grass is always greener, right? Because mine is hypertrophied and is bigger. And so for her, right, her logic behind why she hurt was because hers was bigger, but this person had the same pain was because hers was smaller, right? So there's always some justification that we'll try to do because we're biologically wired. Now, here's the interesting thing, all right, is that I think it logically makes more sense that if it's bigger, then it would be more of a problem. Okay?
Right.
But what's interesting is I said, so your pain in the right butt cheek, I think it was maybe it was left, whatever. Your pain in the right butt cheek, like your piriformis is smaller on that side, and you're justifying that as the reason, right? But your other side, therefore, if this is smaller, the other side must be bigger. And she's like, yeah, but that one doesn't hurt. So like, but if she would have had pain on the other side, guess what? I guarantee she would have said.
Right.
It's because it's bigger.
Right.
So we'll chase it. So what I'd say is this. The actual, like when we've done diagnostic studies, right? We do believe this piriformis syndrome exists, but anomaly wise within the body, like 85% of people supposedly, and this is done cadaver studies. I used to teach gross anatomy. So we found essentially like 15% of people have some type of variant where the sciatic nerve goes through the piriformis muscle. Now, here's the thing, you're born with that. So then it doesn't make logical sense because like, why now does Stan just all of a sudden have this thing where like his nerve wasn't like, hey, I'm going to like regenerate overnight and I'm going to go through it. And like, you've been like that for a long time, if that's the case. So we find that that's like truly a culprit where maybe people need some type of like, we call it like hydrolysis or separation of the nerve from the muscle or something funky, maybe like if needed, like surgical, maybe. All right. But lots of people, it still doesn't really explain it because if that's the case, then why didn't you have pain since you were 5 or something? Right. So the rest of the time it goes underneath it, right? And here's the thing, like the piriformis is just a deep hip muscle. There's many of them, dude, that are right around the area as well. So is it one of the larger hip rotators really in the deep area of the butt? Yes, but there's so many of them that to call it piriformis, sometimes people just call it deep glute pain, like deep glute syndrome, deep gluteal syndrome, because it's really hard to tell. Now, most of the time, these buttock problems are referred from the spine, right? So you'll have like a disc problem in most cases, or a joint problem, and people will be like, I have pain right in my butt. And then I'll be like, well, you think it's in your butt, but it's not. And they're like, prove it. And I'll be like, okay, easy, stand up. And they stand up, and then I'll have them bend backwards. And they're like, like, where do you feel it? In my butt. Yeah, so when you wiggle this segment of your spine, right, it causes pain here. So this switch turns on this thing down here, right? So the number one spot of referred pain from disc problems, joint problems, or whatever is going to be, yes, a little bit in the back, but to the buttock, to the glute. So the number one thing when you think of somebody with glute stuff, right? And if it seems very, very structural, is to say probably spine, right? Piriformis is going to be like a diagnosis of exclusion, meaning it doesn't seem like that, it doesn't seem like that, it doesn't seem like that. It's got to be something deep in the butt. Right. And you can answer that a little bit through treatment too. Right. And this is where kind of maybe some of the motion comes in, because potentially it's like, hey, it might make sense that if you move the back 80 different ways, right, and you try to test, treat, retest or whatever, nothing changes your buttock pain, the chances it's probably coming from your back is probably not very high. So this is where you use different repeated motions and testing to say that or not. So so what I would say to you is just recognize that I can't say for you that, and I wouldn't feel confident saying at all that it's piriformis or not. All right. I would instead step back and say, actually, the chances just statistically that it are very low. Right. And even if it were, right, how could we explain it? If it was an anatomical like anomaly, well, that was probably something you had a long time ago. So does that make sense? Not really. Your case wouldn't really hold up maybe too well. Right. And then have we really done anything with the piriformis to try to improve the symptoms at this point? Not really. So then what's happening, right? We're not structurally changing anything really, right? And we're still moving roughly in the right direction. So I would say that, look, it's normal for you to have that in your brain, right? But I would also say that at some point you have to ask, hey, how does that serve me? And does it change the course of care? Yeah,
that's a good point.
Right? Because here's the thing, like people get really stuck on the diagnostic, like this, and they're like arguing over it. I'm like, so, okay, so I'll just, because you're arguing about it, I'll just say it is that. I don't even care if it is or not. It is. Right. And they'll be like, great, what do we do about it? And I'll be like, the same thing. right? Unless you want surgery or something, in which case,
It's still it still goes back to, I mean, your program. I mean,
optimizing the environment, giving it a chance to heal if it is structural, right? Reframing mindset, kind of beliefs, mental frameworks, fear, this and that, right? And noticing fear avoidance and how those things manifest and turn up the alarm system, right? Then it goes back to gathering evidence. Is it structural? Is it not? Cool. If it's structural, you might really have to go deep into the motion. Yeah, I mean, so the approaches do vary slightly there, right? But it still goes back to really like you've got the mind and you've got the body, and they're just inputs, and you're stuck in a negative feedback loop, whether it's actually structural or not. And so what we want to do is we want to use the body to, instead of doing things that hurt, right, and reinforce signals of danger, we want to move in a good way that feels safe, right? And then that gives you confidence. You start to move more, boom, 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 right? And like you start to spin it in a positive direction.
Yeah.
Now, sometimes it doesn't happen quick enough for people, so people get frustrated, whatever. But really, it's less is more, and just trying to set up the environment, man, like brain and body for healing.
Yeah, that's all. Yeah, that's great. That helps.
Yeah. So look, there's nothing wrong with you, man, in going back and being like, oh, like I wonder if it could be this. You can do that. At some point, though, I would just say, hey, does that serve me or does it not? And is that something I'm willing to let go of or not? You don't have to let go of it completely. It can float around in your brain, but just recognize there are limitations to that thought process.
Okay.
Right? Because then think about it. Like I have people come in the program like, I was doing press ups because I was told it was a disc. So just because you were told something, that belief, whoever planted it, YouTube, your doctor, yourself, whatever, informs what you're doing. So the beliefs will inform the action. So the only thing that I would say, right, is that if you're like, hey, like this thing pops around my head and I'm like I'm really tied to this, then okay, what would you do? Well, maybe you would strengthen it, maybe you would do that, but then like it kind of blindsides you too, because then it leads you a little bit on a rabbit chase because you're not really sure if that's true or not.
Yeah, exactly.
And then you end up with nothing at the end. It's like shit.
Right. Yeah, that's helpful, man. I appreciate that.
So that's that, everyone. Hopefully that was useful and kind of made you think a little bit different about not only sort of what's going on and what could be the cause of your buttock pain, also this whole idea of piriformis syndrome, clearing up any stuff there, and then also giving you some clarity about how you can sort of shift your thought process, ask yourself some meaningful questions there moving forward so that you can actually move towards a solution. Again, if you're still like, hey, I wonder what the heck is going on, what's the cause of this buttock pain, check out my DIY guide. It is all in there for free. So that's it. Until next time, everyone, we will chat soon. Thanks.